Depression is the second most frequent disease in Canada after heart disease. It is forecast to become the #1 most common illness in this country by 2020. 15 to 20% of Canadians develop some form of depression during their lifetime. At Carleton University in Ottawa, Dr. Hymie Anisman is looking for ways to reduce the incidence of depression. With his team of graduate students, he examines the impact of stress on a person's physical and mental state.
And so what we've been trying to do is look at each element of that process and ask the simple question, where are things going wrong? Is it appraisal, coping, some biological system, or some other type of system, and how these then relate to pathology? The particular individual will succumb to an illness depending upon what the weak link in his system is. If your weak link happens to be in the immune system, you might develop a pathology related to immunity, and if your weak link happens to be one with a particular neurotransmitter, you may develop depression. Once we know that, it ought to be possible to come up with appropriate treatment strategies.
Dr. Anisman has also found that an inflammation resulting from one illness can often make someone susceptible to another illness. In fact, depression and heart disease may be more closely linked than we thought.
In the case of some illnesses like depression, you find that there are a lot of comorbid features that are present. That is, other illnesses that occur either in advance of or following the depressive illness. Heart disease, for example, and depression are highly comorbid. Having depression puts you at risk basically for heart disease, and in fact inflammatory processes have been implicated in both of these. And so what we've been looking at is trying to determine what role does inflammation play in heart disease, in which it does play certainly a role, and in depression, and is it causal or simply a bystander?
Dr. Anisman is currently juggling several research projects related to depression. He is looking at social identity as a coping mechanism and the effects of relationship on depression, especially among young people entering university.